So we're going to start with a quick introduction and a few slides around the routes into nursing and midwifery, the availability, what we can do around that, followed by a few guest speakers that will come and tell us their story of being either a nurse or a midwife. So we're going to get on with the show, and I'm going to hand over to Lindsay, who's going to do the routes into nursing slides.
Hello everyone, I'm the other Lindsay in the team, Lindsay Murden, who's also a senior workforce lead. So I'm just going to give a quick overview of what nursing and midwifery is and how you can access these careers. So I'm just going to share my slides. Can you see them?
Certainly can, Lindsay.
Okay. Right. So first of all, we're going to look at nursing and the types of roles available within that. So within nursing, there are 4 fields of nursing that you can choose to specialise in, and they are adult, child, mental health and learning disability. And you'd normally pick which route you want to go down before you would commence your training, because they're all slightly different courses. That does not mean to say that you tend to work in isolation. You can work in various services depending on what qualification you've got, but it is certainly the first part of call for a nursing career. So the first route that you may consider going into to get into nursing is to work as a healthcare support worker. And these staff work as part of that team under the direction of a registered nurse or nursing associate. Their roles and responsibilities vary depending on which area they are working in, and their role is to deliver the fundamentals of care. So this is the entry level of a caring role. And these may work in hospitals, in a care home, in a domiciliary setting. It is really wide experience that you can get as a healthcare support worker. However, it is a really good foot in the door. If you're considering going into any career in healthcare, I would suggest that the starting point would be a healthcare support worker. Even if it's not a nursing role that you're considering, if it's one of the allied health professional roles, this will give you real insight into how all the roles work together, certainly in a hospital setting. So the entry criteria for this role, most organisations don't have any set entry criteria. They may specify maths and English, but they may not. And you will be required to undertake the care certificates. The care certificate was introduced a few years ago, and it's a basic care qualification, which will be transferable between organisations. But it just gives you them fundamentals, that knowledge, and you can demonstrate your ability to undertake them tasks in providing care to patients. So from this, there's various routes you can go down. You can develop, there'll be various opportunities via vocational programmes of learning. So you could go on to be an assistant practitioner, nursing associate, or even registered nurse. Assistant practitioners are other roles that you may encounter. Now, these were introduced maybe a good 10 years ago, and this is still an unregistered role, but it does require a programme of study for you to practice as assistant practitioner. So these again work under the direction of a registered healthcare professional. You develop your skills and expertise in a specific area of practice. And again, these can work across various specialities. So it might be it's a nursing team you're working with, or a therapy area, or theatres. And it's normally to be an assistant practitioner that you've undertaken a level 5 assistant practitioner programme of study. And the entry criteria onto them is normally a level 3 qualification with maths and English. Now, the assistant practitioner role works well in very specialised areas, and it is becoming more prominent mostly with our allied health professional roles, because we now in nursing have the nursing associate role, which I'll talk about in a second. But from this assistant practitioner, you could then go on to be a registered healthcare professional, and it might be a shortened route. So if you wanted to transfer to be a registered nurse, you'd have to do some more training for that, or if you wanted to go into one of the allied health professionals as well. And the qualification you've gained at level 5 you can do something what's known as RPL, so it's recognised prior learning. So it means that a chunk of that programme you are going on to do, you may have already done before, so don't need to repeat. So the nursing associate role was introduced in 2017, and it's a generic role, and it is within the nursing family. So it's a protected title in law, and again, you can only be a nursing associate if you have undertaken a nursing associate programme, which is a 2-year foundation degree at level 5. You're trained to work alongside the registered nurse, and you adhere to the same nursing and midwifery code of conduct. And you have to register with the Nursing and Midwifery Council and maintain your registration. So this is a registered role. Again, the entry criteria will vary depending on which university route you're going down and which university, but most of them, it is just maths and English qualifications that you will need, and that's at GCSE level. And following this, you can train as a registered nurse via a shortened route. And you will need to choose at that point what field of nursing you want to go in. So as I've said, the nursing associate is a generic role. You may be working as a nursing associate in a mental health or a learning disability setting. And at that point, when you decide you want to transfer to a registered nurse, you could pick one of them fields of nursing to specialise in. It's not only adult that you need to pick. So then a registered nurse. So this is the UK's most employable type of degree. So 94% of those that graduate secure a job within 6 months of completion. As we've said, you choose to study one of the 4 fields of nursing. It's registered with the Nursing Midwifery Council, and you've got to adhere to their code of conduct and maintain registration. Now, for registered nursing, the normal entry criteria is 2 to 3 A levels or a level 3 qualification, which is equivalent. Some universities do specify that you need maths, English and science and insight into the role, but they vary. So I'd suggest you look at the university you're interested in. The undergraduate course is normally 3 years, so it's full-time. And if you choose to do a part-time route, it may be longer. And once you have your registered nurse qualification, you can then go on to do further study, whether that's at master's or speciality type roles, training, and you can do your career progression within nursing. The starting point is normally a band 5 staff nurse post, but then through experience and further qualifications, you can progress to higher bands. So where do nurses work? So there's various settings there. There's obviously the hospital general practice and in patients' own homes, but there's a lot more to nursing than just them few settings. Social care settings, that could be care homes, it could be, like we've said, in patients' own homes, in community assisted living areas. There's social care has a variety of settings. It's not just what you think of nursing residential homes. There's a lot more to social care than that. They work in schools, so you could go into schools quite frequently and support children there with their health issues. Prisons, go into higher education and work at the university as a lecturer. Research is another area, and there's many more. Nurses, as we've said, there's myself, Leslie and Lindsay who are working within NHS England in this team, and we're all nurses by background as well, so there is opportunities there. Midwifery. So what is midwifery? So, oh, I'm missing a slide there. So midwifery is the care of women pre and post birth of a baby. It's not just about that nice time of where delivery occurs. There is a lot of pre-care, antenatal care, where midwives support the mother in preparation for birth, but also making sure that they are healthy throughout their pregnancy as well. There's the during birth part as well, which you may all know of, but there's also that after part, that postnatal care as well. So then that postnatal care not only focuses on the mum, but also baby as well. And that post care is either in a hospital setting or can be in own homes or wherever they go on to. So it's a varied role in itself. Again, there is the option of starting as a maternity support worker if this is an area of interest. And again, just like healthcare support workers, they work under the registered midwife and deliver fundamentals of midwifery care to mothers, babies and families. And this is, again, a really good insight into what that midwifery role is. Again, seeing what other members of the multidisciplinary team do, and just really determining whether this is the route you want to go in long term. Yeah, no set entry requirements, but again, the care certificate will be applicable. And as we've said, you could then go on to do very much like the healthcare support worker role, assistant practitioner, nursing associate, or even a registered midwife. Nursing associate roles at the minute are not in a midwifery setting. It's just normally maternity support workers and registered midwives. So the midwife itself, so your lead health professional and contact for a woman providing full antenatal care, identifying high-risk pregnancies and supporting them through that, monitoring women and supporting them during labour and the birthing process, teach new and expectant mothers how to feed, care for and bathe the babies. Again, it's a registered role with the Nursing and Midwifery Council, which are expected to maintain registration, and there's various routes available to access the training. The entry criteria is a minimum of 5 GCSEs and either 2 to 3 A levels or a level 3 qualification. And again, some universities do specify which GCSEs, which could be a science. You can go on to do further study at master's level, or again, very much career progression within midwifery. Now, nurses can also go be registered midwives, and they need to undertake a shortened midwifery programme, which is between 18 and 24 months. So that is an option for some people if they're interested. So routes into training and funding. Most of the programmes that I've talked about offer two routes into training. Direct entry is the most common for nurses and midwives, and this is what we call an undergraduate programme. So it's delivered through a university programme and you would apply through UCAS. And it's funded via the student loan system. So you'd have to apply for a student loan, and also you'd need to apply for some maintenance loans to live off as well. There is some payments available. So you can get between £5,000 and £8,000 for undertaking the undergraduate programme, and that money does not need to be paid back. And that's a bit of a bursary as such to live off there. There is some other funding elements that you could apply for. So if you're studying mental health or learning disability nursing, you can get £1,000. And also if you're in an area of the country that has a low take-up. And they're also giving £1,000 towards childcare costs. So this slide just explains a little bit about student finance, and you can find this on NHS Employers if that's what you're interested in. I'm sure UCAS will also have lots of information. So you need to really get 3 types of funding. So you need your tuition fee loan, which is more your student loan, and that pays for the fees that's given to the university to deliver the course. You need a maintenance loan for living costs, and that's what you can get. Your family would apply for that as well, so taking into account their financial history as well. And there's also a learning support fund, which we've just mentioned a bit on them routes of funding. So that's the £5,000 a year. You do have to repay this. So there is an example at the bottom of how you pay it, but you don't actually start paying it until you're in a job at the end as such. So if you were in a band 5 position at the end, you start paying your loan back at that point. So to secure your place via UCAS, you would need to do a personal statement. And this is the key part of what would secure you an interview or on to them next steps. So some top tips would be to explain why you're passionate about nursing and why you would make a great nurse. And it may be that you've not had any existing experience or you don't think you've had any experience of caring. You may not have had a work experience in a care home, for example, or know a family member who is already in healthcare. But you may have some transferable skills that you can take into nursing. So you may have had a Saturday job working in McDonald's, say, And you will have lots of transferable skills from that. You'll have great communication skills. You'll have how to manage difficult situations, because if chips are cold and somebody's complaining, you may have had to deal with that. So it's all about them transferable skills. So any encounter you've had with the public in a customer service way is a great example of what existing skills you've got and to how you could transfer them into your nursing career. If you've ever done any caring, I'd say really shout about that. And it might be that you just went and helped out in or volunteered in your nursing home and went and sat and talked to residents on a Saturday afternoon, or you played games or whatever. But again, there's great transferable skills in that. It shows that you have a caring nature, and it also shows that you can go and sit and start a conversation with somebody. And at that time, somebody may have disclosed something to you, and it's about how you get the details from them and then pass them on. So there's loads of transferable skills in that. And if there's any areas of nursing that interest you, mention it here. Really say what your career aspirations are. Check your spelling, punctuation and grammar. The first one you write will not be your last. Share it with people. If you're still at school, share it with your tutors. Get them to give feedback. But there is lots of tools on UCAS which will help you write the perfect personal statement. So then other route into healthcare is through apprenticeships, and these are becoming more and more popular within the nursing and midwifery family. There's a bit of an urban myth out there that they're only open to youngsters. That's not the case. Apprenticeships are from anyone from the age of 16, and they offer structured training with an employer, which can lead to qualifications. You are employed by normally a trust, a GP practice, somewhere along them lines that deliver healthcare. They can take anything from 1 to 5 years to complete, depending on what level you're studying at and the employer. And you will have learning in the workplace and release off to university or college to do your academic elements. You work towards a competence qualification, which again is certainly for nursing and midwifery, registered qualifications, because they are exactly the same programme as the undergraduate programme, just as delivered as an apprenticeship rather than an undergraduate programme. So you are getting taught the same thing. There is no change in the level of difficulty, in how it's delivered. It's just how much you attend university will differ to that undergraduate programme. And it will develop your skills, including maths and English. Now, depending what apprenticeship you go for, you may not need to have maths and English at the start. When you go onto your nursing associate, registered nursing and registered midwife, you would need your maths and English. So if that's a bit of a sticking point for some, I would certainly say look into how you could get your maths and English. And it doesn't have to be at GCSE, it could be at level 2 functional skills. So there's various ways you can access that. Some examples there of the available apprenticeships. So you've got intermediate apprenticeships, which are level 2, which are normally around your healthcare or your midwifery support worker level. You can do an advanced apprenticeship at level 3, which is equivalent to A levels, which if you do that would then get you into your nursing, certainly from an undergraduate point. Higher apprenticeships at levels 4, 5, 6 and 7. So 4, 5 are foundation degree level, which is what the nursing associate programme is. And then you've got your degree levels at 6 and 7, which is level 6 is a bachelor's degree and level 7 is a master's degree. So what's the benefit and funding for apprenticeships? So the main tagline for apprenticeships is you learn while you earn. So you are being paid a salary by an employer to go off and get a qualification. There is also some variations in that, because within secondary care in trusts, we work on what's called Agenda for Change and the banding system, which you may have heard of. You would get paid a certain band range of a salary, which is slightly higher than the minimum wage, but some areas may give you the minimum wage. And depending what age you are, depends how much you get. You don't have to pay for the course fees, as these are paid by what's known as the apprenticeship levy. So your employer would pay these. And depending what programme you're doing, there is some funding incentives that can be offered to employers as well, to support through the programme. Just a quick slide again from NHS employers looking at routes into NHS. So we've spoken a little bit about this. So there is the option of like employability programmes. So these tend to be a work placement for people who are looking to get back into employment. There's work experience, which I think is becoming a bit more accessible. Certainly during COVID, it did dry up a little bit, but there is areas that are offering work experience these days. T-levels is another good entry route. This is again linked to a mostly college course at a level 3 qualification. But within that programme of study, there is an expectation that you have some what's known as industry placements. So you will be sent to like a hospital or a social care environment for a certain amount of time, for over certain many weeks, to get that placement, which gives you great insight into what you're going into. There is some supported internships, which are for 16 to 24-year-olds with learning difficulties, disability or autism. So they're quite useful for that insight. If there is any existing nurses out there or midwives who have had their registration lapse, there's something called return to practice you can do, which again gives you an updated academic programme and placement to get you back on that Nursing and Midwifery Council register. There's something called traineeships that are out there, and international recruitment has become quite popular over the coming years as well. So we're taking colleagues from overseas into our nursing and midwifery family. And then, as I've said, apprenticeships is the other route as well. So there's great resources available, not only at the Nursing and Midwifery Council or healthcare careers, NHS careers, NHS employers. There's some links there into some resources. And I think you'll get these slides at the end as well. And that's it. Thank you very much. If there's any questions, we can take them now. I'll leave them right till the end. Mouse isn't working. There we go.
Thank you, Lindsay. I think we'll leave questions to the end if that's okay. And I'm going to call upon Paul now. So we've got a video from Tiff Atkinson, and Paul is hopefully going to play this video quite nicely. Oh, that's perfect, Paul. Thank you very much. So this is around Tiff's adult nursing career. So over to you, Paul.
Hi everyone, thank you for inviting me here today. I'm sorry I couldn't be here in person, but I wanted to share with you my nursing story. So I finished my nurse training at the University of Leeds and I graduated as an adult nurse in 2011. During my 3 years of nurse training, I particularly found that I enjoyed my placements in accident and emergency and the community, which always confused me because they're two polar opposites in terms of placements and nursing and how many patients you have at the same time. So they were my two areas that I really thought I liked. But at the time, with A&E, you couldn't go as a newly qualified nurse. So I applied for lots of positions all over West Yorkshire. And when I secured my first interview and was offered the post, I took it straight away. I was so excited to get started. So I worked for 6 months on a winter pressure ward for care of the elderly. And it was mostly staffed with newly qualifieds like myself and a lot of agency staff and a lot of vacancies. And unfortunately, it wasn't the best experience or what I'd hoped for going into the nursing career. I wasn't given any preceptorship. I was sort of thrown out there in my navy blues and ready to sort of have my own patients. I was given the keys to the drug trolley and I found it really overwhelming. So I did that for 6 months and I thought to myself, I want to give something else a try and just see if I can have a better experience. So after 6 months, I applied I moved organisations and I stayed on a care of the elderly ward. Now, I had a totally different experience in this organisation. I was met by a clinical educator. I thought I was in trouble. Somebody came over to me and I thought, I don't know who you are, but somebody came, and they came on regular occasions just to check in with me, make sure that I was settling in, that I was progressing. They made sure I had a preceptor nurse on the ward that could help me and develop my confidence. And through that, I really did become more confident and felt like I was the nurse that I wanted to be, and that I could give safe, effective care to my patients. It helped me with all my training needs, and I didn't feel like I was rushed to have to run before I could walk. So knowing deep down that sort of A&E and community was still on my mind of something that I wanted to do after 2 years on care of the elderly, I applied for a position in A&E as a band 5 staff nurse, and I was really lucky to get the position. I was really well inducted to the department again. I had my own preceptor, even though I wasn't newly qualified, but I was new to that area, and it was quite a specialised area. So I was given a book of competencies to work through to make sure I had all the skills required for an A&E nurse. And I think having that 2.5 years under my belt really helped me settle into the acuity of an A&E department. I think going as a newly qualified nurse would have scared the living daylights out of me. So I was glad I'd waited that time and got that experience. So again, I spent 2 years in A&E. I could work in all areas of the department. At this point, I'd completed my supporting learning in practice, which meant that I could have my own students on placement, which I really enjoyed. I was leading some shifts in preparation for applying for a band 6 position, and I was lucky to secure that as a development role for 6 months. So I took on the challenges of coordinating the busy department and leading a team of staff, as well as supporting the students. I was given students as a little sort of development position to make sure that they were inducted to the department, had a mentor, as they were at that point now, practice supervisor and assessor, make sure that they had shift patterns that worked alongside the mentors, make sure that they were okay, they had any concerns. And I think I really enjoyed embracing that role because I knew how difficult it was coming into an environment and not feeling supported and well looked after. So after my 6 months of doing that as a development post, I was lucky enough to be offered that full time, but I was at that point asked if I would become the clinical educator for the department, which meant that I wasn't only looking after the students at that point, but I was looking after the preceptees and all the staff that had been in the department for however many years, just to make sure that everyone was continually developing, keeping up to date with the mandatory training, their essential to job role training and medical devices, making sure that the preceptees had that preceptor and that good induction that I had. So again, that was something that I was really passionate about and wanted to make sure people were having a good experience, enjoying the placements with us, and settling into the role if they were new to the department. So after fulfilling that role for around 1.5 years, I took on an opportunity to be a clinical educator for the medical division in that organisation. And that meant that I was covering several different ward areas where I was supporting on a wider scale the students, the preceptees and the staff, working with ward managers to make sure people's needs were being met for development needs, like they were progressing in their careers if that's what they wanted to do. So, and as well as that, part of the role was to work with a team of corporate clinical educators who looked after the internationally recruited nurses that came from overseas. So I was involved in getting them ready for their OSCE. So we did some sort of like mock examinations in our clinical skills suite. So I did that role for 1 year, and unfortunately it was a secondment and the secondment wasn't continued. So at that point, I then looked for a new adventure. I was sort of really thriving in that clinical educator role. So in 2018, I got a position at the university, a local university, where I was a clinical educator for the trainee nursing associate programme. Now, at that point, that role was very new in the nursing workforce. It wasn't very well known. It wasn't very well heard of. There was quite a lot of negative thoughts about that role, about, oh, who are all these band 4s coming in stealing our jobs? So a big part of my role was to break down that barrier, make sure that the trainees themselves really understood what their role was, and that the workforce, the larger workforce, was aware of what their needs were and what they could do, what they couldn't do. And it was also evolving as an apprenticeship then as well, which came along with a whole new set of standards that nobody really knew about. So it was learning about that and making sure everyone else could follow that as well. So I really enjoyed that role. That led on to being a band 7 for the university, where I led my own team of 8 clinical nurse educators, because the TNA course was getting bigger and bigger, and we were having more organisations coming on board and covering a larger geographical patch. So I supported a team of clinical educators who then went out and supported the trainee nursing associates and the areas and the placements. So in 2020, around this time of the pandemic, I started maternity leave. So I went on maternity leave, which I was very grateful that I could have that time to keep my new family safe. And a lot of my fellow clinical educators at that point were redeployed back into the NHS. So I had that time obviously off, and there was a period just before maternity leave where we did try and start moving things so that we could teach things virtually. So I was involved a little bit in sort of making the course virtual so we could carry on educating the trainees and making sure that they were still able to progress whilst this pandemic was going on, that it was all new to everybody. So after my first maternity leave, I very selfishly went on maternity leave again. So I took about 2 years out. At that point, my secondment had ended, so I went back to accident and emergency, which was my roots, where I was seconded from initially. And I did 3 months back in A&E as a band 6 nurse, and during that time sort of really wanted to think about what it was I wanted to do. I think I'd kind of found my niche in nursing, and that was being a clinical educator, so that led me to my role now. So approximately a year ago, I started as a practice learning facilitator at another organisation, which is very much the same thing as a clinical educator, just slightly different terminology, I suppose. And in this role now, as an adult nurse, I look after some allied health professionals, which at first was very daunting, sort of felt like I needed to learn all these new careers, different sort of things. So I look after occupational therapy, physiotherapists, dietetics, speech and language therapists and podiatrists. But really, in hindsight, I think supporting learners can be very much a generic thing. There is some elements of the role where they will want that more specific career advice, and there's always somebody on hand that I can turn to that will help support my learners if I can't do that. But a lot of the time, it's pastoral needs. It's be people coming into roles that have families and responsibilities, and it's understanding that and making sure we can support them to get the best out of their learning. So I also do other parts of the role, which are delivering, we deliver interprofessional learning sessions, which are different bite-sized learning sessions on different topics that are really relative to students on placement with us, such as record keeping, making the most out of feedback. We do one on transition from student to graduate. So they're really well uptaken by students. They're not mandatory. They're also there for preceptees and apprentices. I still look after some trainee nursing associates, which I like. That's like my little baby. So I enjoy making sure that I still have my hand in there in sort of the TNAs and making sure they're all doing okay. Currently, as a trust, we're reviewing our preceptorship package and looking at ways which we can improve this, which obviously I'm very passionate about. And I look back and I think I'm thankful for that difficult experience that I did have, because I think it's made me a much more caring, nurturing nurse, and it's made me want to make sure that nobody else has that period where they feel really unsupported. So it makes sure that I give a better experience to people that I look after. And I think that's everything. So if you got this far, thank you for listening. Nursing's such an exciting career. When I first started, I never knew that I'd end up in this sort of niche little role that I am now. There's opportunities that you'll never see coming. So take it, embrace it, enjoy it. It's difficult, but it's very, very worthwhile. Thank you.
Thank you, Paul. That went quite well, considering that was a video. And in Tiff's absence, I'd just like to say thank you to her. She did take the time to do that. She was very disappointed she couldn't be here, but only to a certain level because she was going on holiday. I think I know where I'd rather be. So I'm going to move on now to Jill Findlay, if that's okay. So Jill, if you'd like to come and tell your story, and I'll let you introduce yourself. Thank you.
Oh, thanks very much, Lindsay. Thank you. Wasn't it great to hear Tiff's story? She's just really passionate, isn't she, about nursing? So I guess I've been sort of wheeled out because I'm at the other end of my career and moving towards sort of retirement. I started my nurse training in 1985. And I've got one slide which I'm going to try and share, if that's okay. I'll see if this works or not. If not, I can just talk through it. So if you just bear with me 1 second. It says it's preparing my slides, so hopefully you'll all be able to see that in a minute.
It's showing, Jill, thank you.
Brilliant. Okay, thank you very much. So you'll see from the top of the slide there that I actually started my career in Great Ormond Street in London. So I started as a student nurse and a staff nurse down in Great Ormond Street. And Lindsay's really clearly explained the way that you get into nursing nowadays and the 4 different professions that there are within nursing. And I decided very early on that I wanted to work with children. But when I started my training in 1985, you couldn't go directly into work with children. You had to have an adult qualification as well. So my degree was actually a 4-year degree, and I did adults nursing and children's nursing all at the same time. So that was just a bit of a quirky way to get into working with children, which is what I knew I wanted to do. Really enjoyed my time down in London. It was also a time when nursing was not a degree, not particularly a degree programme. So most nurses who started when I did would have come out with a sort of diploma level type qualification within nursing and that professional title of registered nurse. So at the time, I decided that I did want to do a degree, but nursing wasn't really open to me as an option as a degree level at that point. So rather bizarrely, I did a degree in biochemistry with the Open University. So at the same time as finishing off my nursing career, I was also doing a degree in biochemistry, which is not a route that I would recommend, but has been interesting. So after I finished at Great Ormond Street, I moved into the field of research, and I worked in Leeds teaching hospitals. And in Leeds Teaching Hospital, I was a research nurse working in children's oncology unit, so children with cancer. It was a very interesting time, and doing the research side of things was really, really interesting to see the new medications and new treatments coming through. And my role then was to work with the families, to take blood samples at certain times and send them into the research lab facility for them to actually work out whether these new treatments worked for the patients. So it was really, really interesting time. Similar to Tiff, I had a career break to raise my family, so just had a year off when I had 2 children under 2. So that was a very busy time. And I came back into a post in Shotley Bridge Hospital, so very different from Leeds, where I was working in the oncology unit. I then worked in the children's unit at Shotley Bridge Hospital as a staff nurse to start off with, just a nurse on the ward. Well, not just a nurse on the ward, but a nurse on the ward. And I was fortunate to be promoted to the ward manager there. Shotley Bridge Hospital was going through some change and closed its children's unit. So rather than me saying, oh, how awful it is, I'm not going to have a job, I said, right, I can set up a new service for you and we will deliver children's care in the community. So rather than working in hospital, our goal was to keep all children in Shotley Bridge out of hospital and to give them the care that they needed in the community. So at that stage, there were no other children's community nursing teams in the North East. We were the first in the North East, and we set that up with the ambition, as I said, keeping every child out of hospital where we could. So we were doing some really innovative treatments at home for patients, things that would only ever have been done in hospital before. And it's a real privilege to be in people's homes giving care in the community. It really is a privilege. So out of all my career, that was probably one of the happiest times that I had. Following sort of just career progression, really, I moved on to work at Newcastle Hospitals, and I was head of children's services in Newcastle, and that gave me my first taste of management. So this was the first move where I really moved away from frontline nursing and into a more management function, which again was something that was useful for me at the time and I felt I really needed to do. And after that, I wanted to specialise a little bit more. And the thing that really interested me, and it came out of doing a master's degree in business administration, but the thing that really interested me was patient safety and when things go wrong. So why do things go wrong? Why do people make mistakes? Why do people not follow the policies and procedures that we have and end up making mistakes? So I moved into that field of patient safety and had a very, very interesting time working in patient safety, seeing all sorts of different things, it's a very different branch of nursing. And as Tiff was saying before, we're really lucky in the NHS because you've got so many different options open to you. And that nursing degree can be a foundation to so many different options that you can go down. You don't just have to be a nurse on the ward or a nurse in the community. And this was one of those opportunities where I was using my nursing skills, but using them to work out why other nurses were making mistakes, why doctors were doing things as they shouldn't have done, that type of thing. So that was a great career move. And as I say, I did my master's at the same time then. So then I moved into much more management functions. So I was what we call a business unit manager for medicine. So that's everything that doesn't need surgery within the Durham Hospitals group, Durham and Darlington as it is now. And that took me into the world of finance and making decisions about how we give care, and do we pay for this particular treatment or that particular treatment, and how do we weigh up the risks of making those different decisions. So again, a really different skill set from the nursing, frontline nursing work that you do, but so important, because if we get those decisions wrong and we fund the wrong things, then it does have an impact on our patients. Then I decided it was time for another change, and I moved to the ambulance service. So I had just short of 2 years in the ambulance service, working with the frontline crews, the paramedics and families in the ambulance service. So again, that foundation that you get with a nursing degree gives you the opportunity to do many different things. So working in the ambulance service was a real eye-opener. And really makes you proud to be part of the NHS when you see the response from the ambulance service. And I know that sometimes they get a bit of a bad reputation at the moment, bad press at the moment with all the queues outside hospitals. But when you see the ambulance teams in action and see them responding to emergencies, it really is heartwarming. So again, great for me to actually do that piece of work, and gave me a much broader portfolio when I moved to my next job, which was a director of nursing. So in the director of nursing role, first of all, I was working in what was the old commissioning groups. So again, this is where you make decisions about the funding that comes in from government. So when we pay our taxes, we pay for health services. Someone has to decide whether that money gets spent on a hip replacement or a new GP practice or whatever that might be. And that was part of the role that I was doing there, helping to make those decisions, and some quite eye-watering sums of money involved in that as well. But it was really good, really enjoyed doing that, and met lots of really dedicated people in the health service. So the final thing on there is my current role. So currently I am Chief Nurse for Gateshead Health NHS Foundation Trust. I'm also the professional lead for midwifery and allied health professionals, which gives me an opportunity to work with different professions, different staff groups. I sit at the board, so again, making decisions about how we invest our money and where we have our different nurses, what sort of opportunities we have for the trust, what our priorities are going to be. And in the last few years, I've done my professional doctorate. So I'm actually a doctor of nursing, which is a bit odd. But I felt that in my academic career, because my first degree was in biochemistry and my second was in business administration, I needed to go back to my roots and do a professional doctorate. So my doctorate is actually around back pain, which doesn't fit with anything I've done previously, but I wanted to do something that was very frontline and got me back to what it means for patients. So as chief nurse currently, as I say, I sit on the board. We have discussions about all sorts of things at board, but my primary role is to set the standards for nursing in Gateshead. So my role is to say what we should be doing as nurses, how many nurses we should have on the ward, and what level of skills we actually need for those nurses. So just a very brief run through, as I say, my main point I wanted to get across was just how many opportunities there are within nursing, and that it isn't just that you have to be on a ward and doing stuff on a ward. So I'll stop sharing now if I know how to do that. Right, I don't know why it's, oh, there we go.
Thanks, Jill. That's absolutely fascinating. And hats off to you for your doctorate.
Thank you. It's not easy.
Are you available to stay around to the end for questions? Yeah.
Yes,
Oh, that's lovely.
Thank you.
Oh, thank you ever so much. And thank you for your story. Very interesting. I'm going to move on now to Joanna, if Joanna's on the call.
Hi everyone.
Welcome. Thank you for joining us.
It's lovely. Hi. Thank you so much. Do you know what I absolutely love about nursing is that we've all started in the same place and we just have the most phenomenally interesting careers. So my name is Joanna Vintis. I'm currently the nurse lead and the head of the workforce development team at Newcastle GP Services, which is quite a mouthful. So what I thought is I would share my journey and kind of share with you my reservations about being a nurse, and kind of how I've ended up in my job and what I do now. So I didn't want to be a nurse as a kid. And I felt like a real imposter for quite a long time because nursing's such a vocation for people and such a passion for a lot of people that you meet that they'll always say to you, sort of, I knew I wanted to be a nurse from being tiny. And I didn't, I was going to go and do forensic science at uni. I had my place to start in September. CSI and all those programs were really big when I was a kid. So I was convinced that's what I was going to go and do. But then life threw a curveball and I met my wonderful husband and we kind of changed our priorities slightly. And I kind of looked at life a little bit differently and thought, I don't want to be working in a lab my entire life. What else can I do? And my mum had been a nurse. And I can remember just one day saying, do you know, I might apply to do my nursing. And my mum went, no, what? Where did that come from? And I sort of said, I've watched you. And she was a community nurse. She went into people's homes and did fabulous things, supporting patients. And I sort of said, I really do admire what you've done. And I think I'll be quite good at it. And she was like, yeah, you probably would. So I took a year out. Instead of going to uni in September, I went and worked in Lidl's. And genuinely, I think that was the best introduction to nursing I could have probably ever had. The ability to work in a really busy shop, well, I'm going to say patients. They weren't patients at the time. They were customers, dealing with customers who were agitated and frustrated and pricings were wrong. And that customer service side of that job really now set me in a fantastic stead to be nurse, I think. So when I got my letter saying I had my place, I was actually at Lidl's and I was on the till and my husband came in and brought the letter. And it was lovely because I was in the front of the line in Lidl's and opened it and everybody in the till kind of gave me a little cheer. And so I went off after a year in Lidl's and started doing my nursing. At the time, it was a diploma. So I started my nurse training back in 2007. And it was a culture shock. It was kind of learning all about sort of how hospitals work, how patients go through the healthcare system, because I'd been so used to what my mum had done in the community. I'd never really thought about hospital work. And I found it quite disheartening because I didn't love it. I didn't really thrive in a hospital setting. I'm a bit of a rule breaker, and like to kind of do things in my own way. And sometimes I felt a little bit restricted as a student sometimes. But every now and again, I'd get a placement that I absolutely adored. And for me, the first one that I really loved was endoscopy. So that's where we put cameras either up or down and have a look inside people. And I was absolutely fascinated that we could look inside somebody's stomach and tell them there and then what their problem was and give them a solution. And it was just I loved that aspect of being able to get somebody in and support them and see a resolution. And I realized very quickly that that's where my strength lay as a nurse. And I actually chose to go back onto that placement as a management student in my final year. And it was lovely because when I went to sort of say hello to the team before I went back, a couple of the doctors actually came up and were like, oh, it's Joanna, isn't it? You were here a few years ago. You were brilliant. Like, we really want you to work in our rooms with us. And what it was that apparently I was just very good at making people go to sleep. So when I was there and I was able just to talk to people and relax them, it just made the procedures much more pleasant. And that's what I found as my superpower as a nurse, is just being able to talk and relate to people and just have that kind of connection with people that is so important. So I really thought that was going to be my career path. But again, the universe had a slightly different plan. And towards the end of my training, I fell pregnant, which was fabulous. And I was very lucky to have a lovely little boy just as I qualified. So all my graduation photos, I have a very, very large baby bump. So took 6 months off and then started looking for a job and didn't really have a plan other than my wonderful, gorgeous small baby was my priority. And I was lucky enough to be able to find a job in a GP practice for just 10 hours a week, which for a new mum was the dream. But I didn't really know what to expect. I'd not really worked with practice nurses before. I didn't really understand the job, so went in pretty blind, to be honest, but very grateful for an opportunity to do it. And what I realised was that it was a great fit for the bits of nursing that I really enjoyed. So loved talking to people, loved being able to translate medical jargon into a way that somebody sitting next to me could understand. And the practice were really quite supportive. They'd never had a nurse that was new before, so they didn't really know how to train me. So I kind of stumbled around for a few years, sort of fallen into training courses and just been like, oh, I'll learn how to do childhood vaccinations, and oh, I'll learn how to do cervical screening and cardiovascular assessments. And it all kind of just started slotting together. And I had another baby. So stayed doing 10 hours a week, which was phenomenal. I'm incredibly lucky that I was able to do that. And then started to think about my qualifications. And as both Jill kind of said before, that I did a diploma, which is slightly different. They don't do diplomas anymore. And I realized that people were coming out with degrees, and I was like, I'm going to catch you guys up. So went back to uni and did some different qualifications there and got my degree in adult nursing. And once I had that, I started thinking about my career a little bit more because my children were growing up, and I made the decision after about 5 years to leave the practice that I was at, because they didn't need me to develop anyway. They were quite happy with the role that I had, but I just wanted to do a little bit more. So I left to another practice, and that one enabled me to sort of flex my nursing muscles a little bit more. I led a team of some healthcare workers who were brilliant, and I sort of mirrored my shifts with another nurse. And I did that for about a year, but then felt a little bit isolated because me and this other nurse, we'd never worked together. And I just felt like I needed another nurse around me. So started looking for other opportunities, and I fell into locum working, which was quite interesting. So that's a bank agency work. They would phone me up and say, there's a practice down the road who need a nurse for a couple of days. Would you be interested? So I went and did that. And that actually was a really big confidence boost for me because I was really relatively young as a practice nurse. Often on training courses, people didn't think that I was a practice nurse because I thought I was the student. That doesn't happen so much anymore now. I've aged slightly, but it was really nice for me to be able to go into different practices and bring my passion to them. And it was a really formative part of my career being able to do that. But then I found a surgery that was quite close to my house, and they were looking for a nurse who was going to move into a more senior position. So they had a nurse who was looking to retire, and the plan was that we were both going to start and she was going to step down and I would step up. And I thought that was a really nice way of progressing my career. Unfortunately, again, the universe decided something different, and that nurse had to retire very, very suddenly. So all of a sudden, again, I was left on my own. But I'd been a nurse at that point for about 7 or 8 years and felt really quite confident in my job. But I did feel like I just needed somebody else. And that's when I reached out to a local one where I studied and said to them, how could I help somebody in the same way that I was helped? And they said, well, why don't you start taking students and return to practice nurses? And you might find somebody through that. And we did. We found my very first student, my wonderful colleague called Karen, and we trained her as she rejoined the register, and then we hired her as a nurse. And that really lit a spark for me for that sort of development and teaching side of it. And I've often heard practice nurses say that it's a really easy step for us to go from being a sort of a nurse who's educating our patients to educating students, because it's the same job, it's just different people. So I started a one-woman mission in Northumberland to try and get more student nurses out into general practice. And I was really fortunate to meet amazing nurses, and I met some fantastic friends and colleagues over the years who encouraged me to follow my passion and to not be afraid to just try something a bit nuts, to be honest. And one of my really close nursey friends, Helen, were trying to get more practices into hosting students. And I sort of said, you know what, I wish I could just turn up on the door with a load of students and go, look how wonderful these guys are. And we sort of went, well, why don't we? Let's just do it. So we created this thing called Nurses on Tour, where we took teams of student nurses out into GP practices and delivered health checks. And we did 724 health checks in the first year. We were recognised nationally. We won a Nursing Times Award for it, and the RCN recognised it, as well as this project that really infused general practice with student nurses. And because of that, I was offered a role in Newcastle just to look at student nurses, which is the dream for me. And so now I'm in a federation, I'm the lead nurse here, and I get to support and put a nursing perspective on decisions that are being made. So we recently worked with Newcastle University pharmacy students, and we built a custom-made bus that we can take out into the community and offer health checks. We're also offering cervical screening, and we're going out to areas where patients don't access healthcare in the same way. So we're trying to be really creative. And this is where being a nurse has given me so many skills and tools that I feel that I'm the right person to be there waving a flag for our patients and giving them a voice, and allowing them to tell us what services should look like. And I'm so privileged that as a nurse, a lot of people trust us because we're fab. We are like superheroes. And I think sometimes we forget that we are, because it's just such a wonderful role. And if you'd asked me 14 years ago when I was qualifying if this is what my career would look like, I would have just thought you were absolutely bonkers, because I couldn't have imagined it. And, you know, Tiff and Jill, I think hopefully hearing from all three of us, you get that impression that we just didn't really know where our careers were going to go. And that's the best thing about nursing. And the nurses that I trained with, that I'm still in touch with, we've just had the most phenomenally interesting careers. And it really does open so many doors for you. And when you say that you're a nurse or a midwife or a nursing associate or a healthcare, people do look at you and go, great, like you must be a nice, wonderful person. And I don't think we could ask for anything more from a career. But it is the career that keeps giving. So who knows what we'll all be doing in the next couple of years. But hopefully that was interesting. And I'll hang around for some questions later as well if anyone's got any.
Thank you, Joanna. That's brilliant. And I think it just shows how diverse these careers can be. And I think the most interesting part is nobody sets out to be where they are. It's just things happen for a reason. So I just find that absolutely fascinating. Thank you. I'm going to move on now to Lizzie, if Lizzie's on the call and can make herself known.
I am. I'm hiding in the background.
Oh, I hope you've got a fantastic story as well, Lizzie.
Hope so. I don't know if I'll live up to everyone else's now.
You will. You will. Thank you.
No worries. Hi, guys. So I'm Lizzie. I am a nurse working in social care, which is probably not where anyone expects to go when they do the nursing training. You don't really get many placements in social care. You don't hear about it, and anything that you do hear can be quite negative, really. So I'm a mental health nurse by background. My placements were primarily acute wards, elderly dementia wards, had some drug rehab units, and I did the standard, passed my course and went into female acutes. I did that for 2 years. It's very different being a student to being the nurse on the wards. Found that it was quite overwhelming at times, especially working with female service users. And after about 2 years, I thought, this isn't really where I want my career to be. I needed that little space to think of what I wanted From that, I found my local nursing home. It's down the road from me. They were advertising in the dementia unit and the mental health unit. I applied for that and then got told that they'd filled that position. However, the home next door had expressed an interest after reading my CV. So I ended up as a mental health nurse on a general nursing unit in a home that had very high clinical needs. So we primarily looked after people with tracheostomies, PEGs. We had brain injuries, strokes, a lot of motor neurone, Parkinson's, so a lot of neuro stuff going on. And quickly realised that, yeah, I'm a mental health nurse and I can do sort of the brain injury side and that emotional support for people, but I needed to quickly upskill in my physical health skills. That led me into sort of finding anyone that I could that would provide training, that would help me look after my residents and lead the team and support the families as well. You quickly realise as a care home nurse that you're not just a nurse, you are a therapist at times, you're that support for your staff, for family members. There's a lot of autonomy in it, in the fact that you haven't got a team around you that you can just bleep. You are the lead on that person's care. You're more of a care coordinator than anything else. So in sort of scoping out learning opportunities to meet the needs of people in our area, I developed a real interest in developing my staff and the skills of the team. So not just the nurses, the carers. We have a programme called which is Nursing Assistants, which is an internal programme. So it was upskilling the nursing assistants, upskilling the carers, upskilling the nurses that were working around me, because we all had we were all at different stages and we all had different levels of knowledge. So I found the TVN service, quickly became a link nurse for those. And because we had tracheostomies in our home and that was a skill that I knew I would need, we were constantly getting referrals. Can you take these people? Can you meet the needs? And we were constantly turning away because we didn't have the capacity to have any more. We had 3 at the time. So I linked up with our local NHS trust, who provided full 2-day tracheostomy training for all of my staff, and managed to become the only home that's commissioned in Greater Manchester with CCG for that service. And it's through doing that and finding those learning opportunities that I realised, you know what, we don't actually have that many students. We don't get the standard entry students coming through, and apprenticeships weren't really a thing at that time. So I started linking up with the universities and finding out what we needed to do. I got everyone to do, again, what it was at the time, the mentorship training. And we started getting that influx of students in. And it quickly developed to take us back 2 years ago. Within the company, we, in our home, had the first 3 nursing associate apprenticeship students. So I sort of led on that, supported them throughout, supported the university, supported with placements, which was a whole other thing, because some universities will do it all for you and other universities you are responsible for sourcing your placements. Through that, I linked up with our practice development team, which is quite a new team within the company, and they decided that actually nursing maybe hadn't been focused on enough, and that the development of our nurses hadn't been focused on enough. So through my work with the tracheostomies and with the students, I linked in with our team and I was able to secure a secondment with those. Obviously, once my students have been signed off and they've all completed now, so they're all qualified. From this, so I'm now the apprenticeship lead. So I work nationally with our students, sourcing external placements, getting external students in the homes and promoting social care placements. There's such a wealth of experience and learning opportunities. You're not in one speciality, you cover everything and anything that comes through your door. You become really good at very quick assessments, responding to emergencies, your communication skills with MDT staff, and you really become more than just a nurse, which sounds really cheesy, sorry guys. So I'm now working with GM Training Hub on getting allied health professional students within our homes as well. And I'm doing some work down south supporting that, because if we can get these other professions into our homes to see what it's actually like on the ground, I think that will only improve the workforce, not just for nurses, but for allied health professionals as well. There's still that stigma. You get paramedics that come in, why are you ringing us, why are you doing this? Well, actually, we look after these people 24 hours a day, 7 days a week. Sometimes you see them more than you see your own families. So that felt like quite a passion for me, of promoting that and seeing what we can do, seeing how we can promote social care and getting homes on that placement rotation for universities for the standard entry as well. Because for me, every student should have an experience in social care, whether it's a 2-week exposure placement or a 8 to 12 week substantial placement. What you're going to get from that is different to what you will get from a community, from a hospital, from other services. From that, we've also started looking at like our RN induction, because we found that actually, although we've got a preceptorship programme and that's fantastic for new starters, we didn't really have that induction in place for nurses that maybe weren't at the start of the career but were new to social care. So I've been working with one of my colleagues to develop that nurse induction programme, which is just going through approval now. And then we're also working on competency management. So I'm looking at learning from events that are being reported in the homes, finding out where that knowledge isn't quite where we want it to be, and developing learning programs for that. So the role initially started as the apprenticeship lead, but has quickly progressed into a lot of other things that link in really well with it, to be fair, and link in with upskilling the staff that we've got, promoting the social care workforce, and just making sure that we can deliver the best care for our residents, because at the end of the day, they're the ones that are at the centre of everything that we do. And I can't think of anything else. Sorry, guys, it's the first time I've done anything like this. But yeah, that's my career so far.
Thank you, Lizzie. And I don't know what you're on about. I don't know if I'll be able to follow on from that. That was amazing. I think you've done some fabulous work, and it just shows how working in different fields of nursing, it's not a band. It's not, you can't leave this
No.
area. There's so much more that you can do. So I'm just going to invite our previous speakers to come and speak. Obviously not Tiffany, who's enjoying herself on holiday, and Leslie and Lindsay, and we're going to open it up to questions if anybody's got any. It's a safe space. You can ask any questions. There's no such thing as a daft question, but we really would like your involvement in this part, even if it's just for some feedback around what you've actually thought. Is there anybody out there? I hope we haven't been presenting to ourselves.
They've all gone very quiet, haven't they?
I know.
It was
Anything in the
interesting, even if we
chapel?
were just presenting to ourselves. That's okay.
Fabulous. Just checking that.
Hello
that's
there.
again.
Hi.
Oh.
I haven't got a question as such. I just wanted to say thank you. It's been so interesting to hear all these different career paths and how diverse it is, the different skills that are involved, and the passion from all of you as speakers. Really enjoyed it. So I just want to say thank you very much.
Oh, thank you. I'm just reading from the chat, and it just says, are there any upper age limits for any nursing discipline? Anyone wants to take that one?
Not that I'm aware of. I think you can come in at any age.
I remember recruiting a nursing associate at 58 a few years ago, and she was very much, even when I've qualified, I've at least 7 years left to work at the time. So absolutely not. And she was amazing. First time she'd ever studied, but she was absolutely amazing. She was a role model. She was almost a mum figure to some of the younger ones out there. She was fantastic. So I would definitely say not.
Lindsay, can I just add to that as well? Looking after return to practice for NHS England, we've had a couple of nurses in the 70s that have returned to practice. There you go.
Oh, you've trumped me. Oh, that's amazing, Paul. Any other, let's have a look at the questions. What are the most beneficial levels to take for a midwifery course at uni? Leslie, as you lead on midwifery, do you want to take this one?
I think it's about A levels, and I think there aren't any particular most beneficials. Lots of them are for a science and things, but it might be worth thinking about the universities you want to go to and just checking their entry requirement for the programs so that you're actually sort of prepared in that level, or having a conversation with the School of Health or the midwifery lead as well while before you're choosing your A levels. But I don't think you can go far wrong if you include a science and things as well.
Thank you, Leslie. And I'm just looking, I think Esther had put, are we getting a copy of the slides? Yes, you can. We'll send those out afterwards. And when I say we, I mean Paul. For someone picking their A levels now, what levels would you recommend? I think that kind of fits with Leslie's kind of conversation just a few moments ago. What else have we got? Lovely to hear about everyone's careers, very inspiring. Can you choose your own shifts or, oh no, it's just moved. Can you choose your own shifts or do you get given timetables? Anyone want to pick that one up?
I think it depends which route you're going, doesn't it? So I know for our apprenticeship students, they work to their contracted hours, but if they've got previous responsibilities, we do try and be quite flexible. Placements are obviously different because it's a learning environment. You've got to meet that 24-hour care process. So it might be that they have set shifts that they put you on, but it's making your needs known at the start if there's any particular days that you really struggle childcare or you have appointments and stuff like that. It's just being honest with your supervisors in practice.
Yeah,
I think one thing. Yeah, sorry, Jill, go on.
I was just going to say, I agree with what Lizzie said for hospital. Obviously, hospitals are open 24/7, so we have to provide nurses for certain parts of the hospital 24/7. But there are plenty of opportunities, as I think we've all described here, where once you've got through your nursing qualification, you can do all sorts of things that could be any hours, just 9 to 5 if you want to, or part-time, as Joanna said, sometimes you can do 10-hour contracts, you can do all sorts of things. But mostly when you go through that training program, there will be some placements where you have to experience that 24/7 work. But as Lizzie's quite rightly said, it's about making your needs known, and generally people will try and accommodate that. But you shouldn't come into nursing thinking that it's not a 24/7 operation, because it is in a lot of cases.
Yeah, and I was just going to add to that obviously when you're doing your training, it is 50-50. So 50% of the time you will be in a practice placement environment, and the other 50% you'll be in university undertaking that theory element as well. So there will be that split.
Thank you. And I think just to add to that, I remember working nights and weekends, and that's when you got some of your most interesting learning opportunities. It wasn't all hustle and bustle. There was less people around. It was like, right, what we're going to do now? We're on our own. This is where we're going to take you. So some of the best opportunities I found were on nights and weekends, and what you're not going to do when there's people not around. Thank you. So the next one is, where are apprenticeship opportunities advertised? Lindsay, I'll come to you for that one.
Paul's answered it. Mostly NHS jobs. Yeah, NHS jobs, because they are employers looking for apprenticeship. So you need to look at the employers. So if your local area uses NHS jobs, track whatever they advertise on to look through there.
Thank you, Lindsay. And Anna's asked, do you have any thoughts about the access to nursing courses?
I think they're very good if that's the route you want to take. They do offer that level 3 qualification that is needed for some programs. But as I said, there is not everywhere requires that level 3. It depends what the next step is. If you're looking at apprenticeships, you don't always need that. But if you're wanting to go via the UCAS route, you may need a level 3. And it's just a great alternative to A levels.
Agreed. I remember starting my nurse training, and if I could have done any other route than university, I would have jumped at it, because I just didn't want that university life, but it was my only option.
It serves you right for
I've
being
actually
so
got-
young.
I've got 2 students at the moment who they're about to qualify from their nursing degrees in the next few weeks, and they both did access courses at a local college, and we were there doing sessions, and they found out that tutors were working that day. So we ran through the college with these 2 students, and one of them did it 10 years ago. When she first came into the country, English wasn't her first language, and Dean, who was a male student, had only done it sort of 4 years before, and seeing them being able to talk to the students that were in their position a few years ago was so lovely. And the students took about an hour just asking them so many questions about, you know, what's next, how does it look? And for Dean and Elbertel to both be able to stand there and go, we can do it. Like, guys, you've got this. Just keep going was really good. So the access course for them was fantastic. So do consider it if it's a barrier to you getting in.
Thank you, Joanna. Thanks for sharing that. I'm going to go around the panel with this one. So when dealing with difficult situations or emotionally difficult cases, how do you cope? So I'm going to start with Lizzie, only because you're on my top left side of the screen.
Practice. It will be incredibly difficult when you first start, and people say that you get used to it. I don't think you do ever get used to breaking bad news or dealing with difficult situations. You become, I think, over your career a bit more emotionally intelligent, and how you manage it, how you manage the people around you. Use those debriefs that you're offered. I've had multiple situations, especially on the female acutes, where you're offered a debrief and it's the best thing you could ever do, because how you're feeling after a difficult situation or conversation is how your colleagues are feeling as well. And if you don't talk about it, and that helps you build, and it's not a resilience because that implies that it doesn't affect you anymore, but it helps you build then coping mechanisms for dealing with it.
Thank you. Joanna, you're next on my list.
I think, Lizzie, that was phenomenal. That's like the answer we should give every nurse ever. I think for me personally, I was really shut off when I started my nursing career because my dad passed away 3 months before I started my nursing training. So I found any conversations around death and dying incredibly difficult because I felt like I was supposed to look emotionless and kind of just always look okay. And it took a really wonderful nurse crying in front of the patient and the families with them in the most wonderful, compassionate way, and just going, it's okay to be human with these situations. You know, yes, they want us to be there for them, but sometimes they just want to know that you care, and being able to do that. So now I cry all the time, and it's very good for me. It's good for your skin to cry, but that's the way that I personally I deal with things, and that's okay, whatever your thing is. I also like to game a lot, so I'll quite often beat things up with swords online. So that's a good coping mechanism.
Oh, thank
I'm
you.
so glad you said online at the end of that.
Online, yes, it is online, I promise.
Oh, and Emily's just put at the bottom, what's a debrief? So I don't know if one of you'd like to pick that up just before we move on to Jill.
Sorry, do you want me to do it? So a debrief is a safe space. You can discuss the incident, how it made you feel, if there's anything that you felt as a team you did really well or you did maybe badly, because it does happen. Things don't go perfect every time, but it's really that safe space to let things out and not build it up. And that's where you find out that actually everyone's feeling the same and you're all human. Like Joanna said, it's okay to cry. You're in nursing, it's going to make you cry at times. But yeah, it's just that safe space afterwards to go through it, find the good, find the bad, and learn from maybe what's happened.
Thank you. I worked on intensive care for around 7 years when I first qualified, and I remember we had to withdraw treatment on 2 separate people. Well, I did on the same day, and I thought, oh crikey, how am I going to do this? Went through everything. Everything went nice and smoothly, and then one of the sisters just said to me, "Are you okay?" And that just broke me. And I thought, well, I was. And I've just thought, oh, crikey. So a debrief can happen at any time. And obviously we went off separately and had a discussion just to kind of see how I was feeling. And I thought I was doing really well till she asked me that one question. So I then said to her, don't ask me that again in the middle of the ward. Oh, thank you. Jill, anything else to add around this?
Yeah, I think you've all given really model answers. It's brilliant, really. So my first introduction to really difficult conversations was at Great Ormond Street, where you're telling families that their children are, not going to survive what you're doing. Really, really challenging conversations, and you get through it by your team, by the people around you, by the people who help and support. And as the other two ladies have said, it's really basically that being aware that you're a human yourself. So I would defy anybody to tell a parent that their child is not going to survive something and not be upset and emotionally bought into it. Really, you just have to go with it. If you're going to cry, you cry, and most parents respect that. But you obviously don't want to be a blubbering wreck at the end of it. You still need to maintain some professionalism, but it's absolutely fine to be human and to share your emotions. But as Lizzie says, the most important thing is that you look after yourself. It's that put your own oxygen mask on before you deal with everybody else. Make sure you're well adjusted and that you've had the time to debrief, you've had the chance to talk to your colleagues, and the team is what makes it, the team that you're working with, people that are around you, that's what makes nursing so brilliant.
Absolutely. Thank you. Will there be an induction day for people who would like to be involved in this type of occupation like they do at the college or university? I think that was Asif. Asif, would you like to, not putting you on the spot, but would you like to explain a little bit further about that? If you want to come on to the microphone, if that's possible. Maybe that's not possible. Would anyone like to pick up a little bit around this? So it's quite generic, really, around an induction. I would say you're probably more looking at an open day from university.
Yeah, I was thinking open days, the university. Sometimes trusts will do open days and things and have sort of summer schools and that type of thing available to sort of go in and have an experience, really.
Yeah, and Leslie, Lindsay and I will put our email addresses in, so if you want to pick up a separate conversation, because I've just seen it said it won't let him, more than happy to have email or a phone call conversation with you around some of that as well, if that would help.
Yeah, certainly from Gateshead point of view, we do an open day once a year for students who might be interested, and once you're on the course, there's an induction day when you first come in, so before your first placement, we'll bring you in, get your badge and your pass sort of for when you're walking around the place, things like that. So you wouldn't just be thrown onto the ward and right, crack on with it, off you go type thing. We do look after people when they first come in.
Joanna might looking at her face. Thank you. Can one transition from a career in adult care as a caregiver into nursing and midwifery career? Helen, I think the nods are answering your question there. And I think that's the last of the questions. Paul, I don't know if you want to unmute anyone in case there's anyone wants to ask a verbal question over the last few minutes or so.
Yeah, I can unmute everyone if anyone wants to raise their hands and ask any questions.
That'd be great, thank you. Anyone? Not seeing any hands. Any last comments from anyone on the panel or colleagues? Nope. Lizzie, Joanna, Jill, I can't thank you enough. You've been absolutely amazing. I think you've shared some fantastic short stories. I think you've just opened up the opportunities and inspired quite a few more future nurses or midwives out there. I just think it's been amazing. So thank you so much for taking this time to do that. And I think that's starting to come through in the comments and the chat now. So really inspiring. What more can you say? So thank you.
Thanks for organising. Thank you.
Thank you.
Thank you.
Take care, everyone.
Later.
Bye.
Bye.